The monkeypox outbreak is now a public health emergency here in the U.S. Here to answer your questions is Dr. Marty Hirsch, a senior physician in the Infectious Disease Service at Mass General Hospital. Doctor, thank you so much for joining us this morning. First, let's take a look at these numbers here. So far, the CDC has confirmed more than 7,100 cases nationally, including 157 so far in Massachusetts. In your opinion, is it too late to get this virus under control now?
No, it's by no means too late. Obviously, we would like to see fewer cases than there are, but the mechanisms to get this under control are still with us, and I think we have an excellent chance to control monkeypox. This isn't COVID where there's rapid respiratory spread, and we know exactly how we should control it. We have the diagnostic tools, we have vaccines, and we have therapeutics. So with a maximum effort, like the federal government and the state government are now using, we should be able to get this under control in a reasonable period of time, though undoubtedly there are going to be more cases in the next week or two or three.
Well, speaking of how it's spread, the CDC says monkeypox is not a sexually transmitted infection, even though most of the patients so far do involve men who have sex with other men. What are some other ways, though, that this virus does spread?
Well, we do know that it is spread by very close contact, and there are viruses that are in oral secretions like saliva. People are reporting that it may be in genital secretions as well. So very close contact, skin to skin, mucous membrane to mucous membrane are the primary ways it is spread. It can also be spread from people who excrete the virus onto pillowcases, sheets, linens, and the like. The virus is pretty hardy. So when you're dealing with those, you need to disinfect them or wash them very thoroughly in hot water.
Well, we have received a number of emails from viewers asking if vaccines for other diseases such as chickenpox and shingles provide any protection against the monkeypox. What's the answer to that?
No, the answer is really no. This is a very virus-specific vaccine. We've had it around for many, many years. Those of us who are over the age of 50 or 60 received the smallpox vaccine routinely to prevent smallpox before it was eradicated in 1970. And so the older people have really an advantage because they probably have some protection against this virus. It's the under 50 people that are really at greatest risk. And we do have a vaccine. We have a couple of vaccines that are really modified smallpox vaccines that are generally safe and effective and should be utilized by anybody who comes in to very close contact with someone with monkeypox or even with suspected monkeypox. And there are vaccines that are being administered in Massachusetts at Mass General Hospital and many other places that are very effective, but don't rely on other vaccines like the shingles vaccine or measles vaccine or any other virus vaccine.
Okay. Dr. Marty Hirsch, a senior physician in the Infectious Disease Service at Mass General Hospital. Doctor, thank you so much for joining us this morning and all of your insight on this topic.
My pleasure. Thank you.